Hi, thank you for tuning in to Science with Chris. Today I'm going to be discussing Aicardi Syndrome, and I'm going to be specifically looking at two papers that I wanted to present. One of them was called Aicardi Syndrome and Cognitive Abilities, a report of 5 cases by Tuft et al. This was published in 2017 in Epilepsy and Behavior, and it was focusing on 5 cases in Norway. Second paper, Agenesis of corpus callosum and Aicardi Syndrome, Neuroimaging and Clinical Correlation, was a 2016 paper by Govil-Delela et al., and this was based off of research in Detroit. The first thing I want to start with was the Norway paper, but before I get into it, all the information regarding Aicardi syndrome has already been put onto YouTube primarily by Dr. Boone at Learn Medical Genetics, and I'll put the video right here hopefully. So his video is going to talk to you about the classic triad with the agenesis of corpus callosum, the chorioretinal lacunae, as well as infantile spasms, but also some major and minor features. He's also going to go into the inheritance pattern as well as the clinical and treatment for it, and some differential diagnoses. So if that's what you're looking for, then click on this video. This is looking at more future outcomes and expectations in patients with Aicardi syndrome. So the 5 cases in Norway. So this paper was looking at the outcomes in 5 individuals. And these 5 individuals broken up into 3 categories. And these 3 categories were divided between their diagnosis. So they're diagnosed with either profound, moderate, or mild intellectual disability. The first group was 3 girls, and this was a profound intellectual disability. They were diagnosed with this at age 5 or age 6. So this is kind of looking at the outcomes of Aicardi syndrome, not necessarily the pathogenesis. So the outcomes of it. So at age 5 or 6, they're diagnosed with profound, and what that meant for us is they're pretty much confined to a wheelchair, and they had a gastric tube. This was for their feeding. In addition to that, all 3 of these had infantile spasms and a hypsarrhythmia, and I can show a picture of what hypsarrhythmia is right here. Hypsarrhythmia is an abnormal EEG finding of a spike and wave pattern. It is not a diagnosis that you see, but rather you locate on an EEG. Sorry. Moving forward, we have girl 4, which is the second category, which was in the moderate intellectual disability. At this, she was diagnosed at 6 years, and what differentiated her from the other group was that she was able to respond to visual stimuli. She was able to use 3 words, and she had a vocabulary of 5 to 10 different symbols. The moderate intellectual disability was associated with fewer seizures and less epileptiform activity on EEG. And she was able to respond and kind of locate happy sounds and dictate kind of her mood. Girl 5, which was the most positive outcome in the diagnosis, was a mild intellectual disability. And she was followed for a lot longer, so her first diagnosis, or first interaction for her psychomotor eval was at age 5 and then age 6, and the final one was at age 13, which showed a mild cognitive impairment. And what they showed was that there was actual improvement as she aged, and specifically when she was around 13 years old, she was noted to have a working memory that was in the normal range, as well as visual memory that was in the normal range as well. Working memory, an example of this is when I were to say to you several numbers and you would repeat them back in the reverse order. That is working memory. So she had longitudinal analysis was very positive, so there was improvement with this. All this was done at their patients' homes, so they had a lot of ease and comfort when they were doing the studies. Bottom line of this paper, along with the positive prognosis as we move forward in their diagnosis, was that there was favorable outcome in individuals that had less epilepsy, so more cognitive impairment was associated with more epilepsy, more infantile spasms. And the next paper I want to briefly go over was the 2016 Detroit paper. And this Detroit paper once again goes into the basic pathophys of Aicardi syndrome, which you can see in the other video. But what I kind of wanted to kind of look at what the paper was is comparing Aicardi syndrome from other patients who had agenesis of the corpus callosum. ACC is what I'm going to call it from now on. And they were able to show, and this was in table 1, the comparison between age at seizure onset, seizure frequency, prevalent seizure types, abnormal muscle tone, retinal abnormalities, which was all Aicardi, verbalization, ambulation. I'm going to put the figures up right there so you can kind of look at it a little bit, or the link for the paper is down below. They also showed some neuroimaging differences between the two. Specifically, the most different ones were a sulcal gyral abnormality. Another thing they found was in 4 patients, 2 of them were with non-syndromic ACC, and the other 2 had Aicardi. They all went through a palliative surgery to kind of reduce the amount of medical refractory seizures, and all the patients, whether or not they were syndromic or not, benefited from this, where that they showed decreased seizure frequency throughout later time courses. So immediately after the surgery, as well as years after, there was a decreased frequency in surgeries, a decreased frequency in seizures, which means that it might be beneficial for patients if they know the benefits and know what the general outcome should be, that there may be a surgery for palliative care might be beneficial in these patients. Aside from that, that's all I wanted to talk about regarding Aicardi syndrome. Hopefully those 2 papers kind of gave a little bit more insight and you're able to know a better breadth about Aicardi syndrome. Thanks.